This is a presentation of the business value of information technology and the evaluation of the Veteran Administration's return on investment for its VISTA electronic health record. There are many organizations today that have invested in IT investments which did not pay off. Some examples of these are the failure of Kmart's $130 million software system, the $120 million loss in sales Hershey experienced after a new distribution system, and Nike's $400 million system, in which led to decrease in profit. The problems with information technology is so widespread that it could not be due to mismanagement. The problem is with the methodology of assessing the value of IT projects. The current bottom-up approach of listing a series of costs and savings is not working. This process fails to examine which business processes will be affected. It assumes IT will increase revenue. It assumes unused buildings have no IT costs, and training and maintenance costs are ignored. Also, the impacts on productivity and quality are also ignored. The proposed analysis will be examined in a later slide. The Veterans Administration Order was officially signed in 1930. It is responsible for providing federal benefits to veterans and their families. It is estimated that over 74 million Americans are eligible for VA benefits. The most visible of these benefits veterans receive are health care benefits. The VA healthcare system includes 155 medical centers and operates more than 1,400 sites of care, including 872 ambulatory care and community-based outpatient clinics, 135 nursing homes, 45 residential rehabilitation treatment programs, and 209 veteran healthcare centers. These VA healthcare facilities provide a broad spectrum of medical, surgical, and rehabilitative care. VISTA stands for the Veterans Health Information System in Technology Agriculture. It is an information system built around an electronic health record and is utilized throughout the Veterans Health Administration. VISTA is the most widely used EHR around the world. It supports both ambulatory and inpatient care. The VISTA system includes computerized outpatient record system for clinicians, computerized order entry, barcode medication administration, electronic prescribing, and clinical guidelines. The VISTA electronic health record is estimated to improve efficiency by 6% per year. The monthly cost of the EHR is offset by eliminating costs of unnecessary tests and admissions. The adoption of VISTA has allowed the VA to achieve pharmacy prescription accuracy of 99.97% and has been widely accredited for reforming the VA healthcare system and improving safety and efficiency substantially. The information on the previous slides was obtained from the websites noted here. In the slides to follow, an evaluation of VISTA's return on investment for years 1999 to 2004 has been conducted. The components used to evaluate the return on investment are the budget of Office of Information, the numbers of records in VISTA, and the VHA cost per patient index. The proposed analysis evaluates costs of the IT project by starting with the total organizational cost. The idea of the proposed analysis is to start from the top and break the total organizational expenses into IT costs. Only when this proposed method occurs will a more complete picture of the IT costs will emerge. The steps in the proposed method are as follows. It starts with gathering data over at least 3 time periods. In this evaluation, the components listed on the previous slide will be evaluated over the period of 5 years. The next step is examining the association between the components. This is done by using a scattergram. It is important to see if there is a large correlation between IT investments and revenue. The investment should be related to all 3 components. If the relationship does not exist, it is doubtful that the IT investment has led to increased returns. If the association does exist, then we are ready to examine the direction of cause and effect. The third step is to examine causation. During this step, we will look at the IT investment, IT use, and revenue. This is to say that there is a special relationship among the correlation of each of the two variables. The correlation between the start and the end node should be equal to the multiplication of the correlations of consecutive nodes, or, in other words, the correlation of the starting and middle time times the correlation of the middle and end should be equal to the correlation of the starting and end node. The last step is to calculate ROI, the return on investment, which was not done for this evaluation. This scattergram represents the VHA cost per patient index and the budget of the Office of Information. The correlation is 0.08, which represents a positive correlation. The next scattergram shows the VHA cost per patient index and the number of records in the VISTA system. The correlation is 0.4. This shows a weak relationship. This next slide shows a scatter graph of the number of records in VISTA and the budget of the Office of Information. The correlation is equal to 0.06, which represents a weak correlation. To understand these findings, a positive correlation only exists between one of the sets. This is between the budget of the Office of Administration and the VHA cost per patient index. Upon conclusion of this analysis, the following limitations were found. The first being that the information provided by VA was taken over a short time frame. A larger time frame would allow for a more accurate analysis. Also, the method only provides a correlation between variables and fails to illustrate causation. This concludes my evaluation of the VA healthcare system's return on investment for the VISTA system.